Precision medicine implies that there's marked variation in characteristics across the population, and that we'd be best to focus our treatments toward those individual characteristics. So yes, it's about providing the opportunity to understand each individual's risk and each individual's response to particular therapies as we inform the decisions about what particular strategies to pursue. And so precision medicine is introducing an idea that we need to get closer to the exact risk of an individual, that how they resemble a small group of individuals like themselves and how their response is characteristic of that group. How will we reconcile precision medicine with evidence-based medicine? It's a good question because our evidence-based medicine has been largely built on large trials that have been able to discern average effects in large populations with a particular condition or with a particular risk. Precision medicine is focusing a little more narrowly on specific subpopulations of individuals. I think what you'll see is that evidence medicine will evolve. We'll continue to want to use trials and to take advantage of randomization in order to produce valid estimates of response to particular therapy and risk of particular therapies. But the precision medicine approach may help us understand an individual's risk and response in ways that we haven't before. They may serve as inclusion criteria for particular trials that are able to be smaller because we expect bigger effect sizes from the interventions. They may evolve in observational studies in ways that we need to continue to refine, especially to be able to reduce the likelihood of bias. But we will continue to rely on evidence-based medicine, but that evidence may change somewhat as we begin to think about how can we generate the knowledge that we need that will help us do best by each individual and not just produce large average effects for heterogeneous populations and be able to focus more clearly on what each individual needs. Can precision medicine help us to eliminate disparities in our healthcare systems, or might it exacerbate it? It's another question that's been asked and one that's worthy of consideration. The hope is that by focusing specifically on what each person needs, understanding their individual risk, incorporating various different aspects of their characteristics in those estimates, and understanding their likelihood of response, we'll be able to eliminate differences in the way that people are treated based on their skin color or their socioeconomic status. It will help us to more finely focus on what each individual needs. It may also illuminate the degree to which disparities are fueling differences in estimates of risk and response, in the sense that if someone's skin color or their socioeconomic status is an important factor in the way that they're responding to treatments, or their ability to access treatments, or their ability to afford treatments, or their ability to adopt behaviors that'll help them do better, then it will illuminate to us what's needed in the healthcare system and in our social system and in society as a whole to try to address the underlying causes of those disparities. We want to be able to use precision medicine to understand what's biological, what's social, what's modifiable, what's fair. And ultimately, it should be helping us drive to a more equitable society, one in which social justice is an important consideration, and help us to focus ever more intently on ensuring each person gets what they need to have the best possible outcome that they can achieve.